hello everyone. Glad you could join us tonight. We're gonna have some fun tonight. I got the special guests on, Tammy and Tom Spillis, who are from the boy, I forgot the state they're from, but anyways, they're from one of the U.S. states, and they will uh no, you can't have it. Anyways, we gotta have some fun around here. So I just want to let everybody know that Tammy and Tom have had some real good success with the light, and they've been able to share it with a lot of other people. I think you're really going to enjoy tonight. So just we have the Palm Ultimate device that will be given away. Actually, this is the last weekend of the month, or weekday of the month for Tuesday. So next Tuesday will be, hopefully by next Tuesday, we'll be able to tell you who has won one of these devices. So it is a Palm Ultimate. It's $1,300. It treats all different kinds of parts of the body, and it has the red wavelength, which can penetrate really deep, as you can see in this video. It's going right through my palm of my hand. As well, it has the near infrared, the 810. You can't really see it. There you go. Very well, but this actually penetrates much more. This wavelength, if we were to measure it through my hand, if I looked at how much energy was going through my hand at the 660 nanometer, the bright red, if I go to the near infrared and I did a measurement on there, anywhere from 10 to 20 times more light, depending on exactly where I place it on here, depending on what it's all going through, 10 to 20 times more energy is getting through at the 810 nanometer. So yeah, so some would say, hey, that can't be very, the science has said only a couple millimeters. Well, that's very much bogus. That might be when you get into the blue UV range that you only get a couple millimeters or millimeter or two. But when you're talking of light in 660 nanometer or 810 or 1050, much, much deeper. Obviously, the thickness of my hand is much deeper than a few millimeters. So another thing is they say, well, you got light devices for the brain. Can it actually penetrate the skull? It's hard. Well, this is, we're very thankful to a fellow we named Alfred, who gave us Life for Science. This happens to be Alfred, and he wants to say hi. Hi, everyone. Anyways, this here is a real human skull. And so I'm taking the light and I'm putting it inside, and you can see it's going right through. As a matter of fact, you can see how the light is even going through more through the sutures, through the skull. And if I turn it around the other way from the outside, you can see how the light is going through. That's with the red. And then if we did the near infrared, the other wavelength that you can't see right now, again, can be 10, 20 times more light coming through this skull in this wavelength of 810. So now what we're going to do is we're going to go with a short little video clip, and then we're going to start our program. So here we go. 15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your finger, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs. All right, so now we're going to introduce you to our guests, Tom and Tammy Spillis. Thank you, Tom and Tammy, for being on the show tonight, to this webinar, to this interview. So tell me a little bit, how did you first hear about red light therapy?
Yes, well, we had, as Tom had mentioned earlier, or Tom, when we were speaking, he had suffered a stroke and went through multiple rounds of physical therapy. We had a good hospital, good setup. But from that point on, we started outreaching for other types of therapy that might improve past the physical therapy. We have a good MD there, and we would bring things to his attention. He would research it. He'd say, okay, go with this. That sounds good. So we were not just going out there shotgun kind of broad spectrum.
Right.
But so after the stroke, my husband had like terrible things happen. He had hernia surgery, he had cataract surgery, he just had everything come on down. And then, but we're still searching. And we learned about, I'll just say this, iodine and salt, how crucial it is to the body. We learned about that in March. We learned about from a holistic doctor in Michigan, Dr. Brownstein, should give him credit. And then after that, we kept searching, and I learned that for the muscles, that a red light therapy can help with muscles. And so I invested in 2 devices, which I now know are just surface, and it was a waste of money. I could have bought a real palm light for what I paid for these other products, but but I was looking for something that would reach and help with muscles for the stroke issue on the right side. It was an ischemic stroke, not a bleed, so cognitive function is totally intact, but he was paralyzed totally on the right side.
Mm-hmm.
So then searching red light, I was looking at influencers, and persons who were reviewing these, and I came across Alec Fergus.
Okay.
And then, yeah, there it is. And I followed him to the London PBM Foundation, to that where he was interviewing all these entrepreneurs. And so I was staying with Alex, and watching everything, because I was really wanting to go with a good product. And I'll just say, Tom, when he interviewed you, I just knew. I said, when he interviewed you, I said, this is a man who is altruistic, and speaking of you, and is technically savvy. And I just saw the confluence of both of those things working. And I saw Alex Fergus take a step back, knowing that he was not listening to advertising hype, but he was listening to someone that had a product that was worth the money. I remember him saying, "Why is it so expensive?" And he said, "Well, LEDs,
Yeah.
like." I just remember him saying that. Why is it so expensive? And you explained to him, how you had the different, the dioptics, how they all, went on this, where they reach like pyramids like this, and they crossed. And so the next day I got on the phone and called. Um, I don't even know if you were back from London, and I called and ordered a palm light. Yeah.
Oh, that's neat. As a matter of fact, that was a great event. Talking about things that can be expensive, that was a very expensive trip, and to sponsor the event, and part of the reason I wanted to be able to present our findings on lasers and LEDs and how you know, if you have 5 watts for a laser and you have 5 watts for an LED, and you shine them through, in this case, 2¼ inches of steak or pork or chicken. I did all the research at one of the universities to show that that light, when you put either a laser beam on top of that tissue or whether you had an LED, and we put our LED device somehow, the cord's a little short, but anyways, when the light is on top of the tissue and you're shining
Yes.
through the tissue,
Yes.
what's coming through the other side. And
Mm-hmm.
when I did that and did that those measurements, that research, I was able to show that really in the end there was no difference between when they had the same optical power, they had the
Mm-hmm.
same amount of penetration through all
Mm-hmm.
that tissue. So that's why we can get down to hip joints and have people with sciatic hip joints
Mm-hmm.
who are have got a lot of pain, and the pain is goes away. And
Mm-hmm.
I just spoke to a medical doctor today who was in Egypt, and he brought his light with him. And he says, I couldn't
Yeah.
help myself. I saw the one guy who had made this trip. He had such extensive sciatic hip pain, he couldn't go out for the walk to go see one of the pyramids. And he said, "Well, would you like to try? Would you like me to show you how this light could probably help you?" And the guy, I guess, was pretty. Why not? You know, hey, he was willing to give it a shot, and he did 5 minutes of the bright red and 10 minutes of the near infrared on the spot that hurt so much he could feel that right in that area,
Mm-hmm.
and he was able to go out on the walks the next day. Like
Yes.
this is the crazy part about this is, you know, the light can do this, and it doesn't have to be a laser.
All
So,
right. And
and
we've,
yeah,
go
so
ahead.
you saw the PBM conference, and
Yes.
I was
Yes.
able to present there and meet up with Alex. And as a matter of fact, Alex then introduced me to another podcaster out there, Ari Witten, and wow, what a lot of people found out about what we're doing, and it was great.
Yes.
It was really good.
Yes. And so once we had learned about red light, it was meant we started researching. We got a couple of, well, let's say PBM, I know, but we looked into Mark Sloan's book on methylene blue and also on red light therapy. We looked into Dr. John Lawrence's book on methylene blue, the magic bullet. And you had mentioned on your podcast or on your
Yeah.
webinar about methylene blue.red, and
Yep.
we went to there and we watched some interviews, and so then we consulted with our MD, and we showed him the research, consulted with him. My MD also told me, because we have different MDs, that there was a test, an enzyme test, called G6PD, and only 1% of the world's population cannot take methylene blue. She
Oh,
said, only 1%. She said, but Tammy, it has to do with North African and Mediterranean descent, and it's just 1% of the population. So she said, here's the test. We did the test on you. You're good. Have his doctor do the test on him. We presented that to his doctor. He did the blood draw. It was covered by Medicare, and found out Tom's good to go with methylene blue. And again, I don't want to mention our medical doctor's name because it could sometimes come,
yeah.
different, So
Different
anyway,
folks see it differently, but you got two doctors who really care and are willing to
yes,
work with you, and that's fantastic. You
it
know,
it is, isn't it, Tom?
Yep,
Yeah,
rare.
it's rare. And so he not only uh checked Tom for that. He then recommended a dosage for Tom. And I said, well, then will you be prescribing it? Again, it's, I am not qualified.
Right.
I'm not qualified and I didn't want to overstep boundaries or be unsafe. And so he said yes, and he gave us a dosage. And I said, so will you be prescribing? He says, no, Tammy, buy it off Amazon. I said, oh, no, doctor, I can't do that. How do I know if it's good? And he said, I know. I looked up a brand for you that is USP grade, third party tested, and I want you to buy this brand.
Ah, there we go. Yeah.
Wasn't that sweet?
Yeah.
Uh, and
Yeah.
so then we started with the methylene blue in November. We got our first palm light. We got our first palm light in December. Then we combined them.
Yes.
And
So just for people out there, just to say what's going on. So it turns out that red light on its own, or the red or near infrared, as is with photobiomodulation, is really, really good on its own. And methylene blue has some great properties as well. But if you use the methylene blue with the red, not the near infrared, and a person still can use some near infrared, but it will do nothing for the methylene blue. There's a reaction curve that looks like that. And our red light is right in the middle of that spectrum. You couldn't find a
yes,
better match for
no,
660 nanometer light coming from
right,
either any one of our palm devices is the right wavelength to properly, you want the maximum absorption
right.
and what it does then, it does some beautiful things. And I would do it probably injustice to explain exactly. So my suggestion is go to www.methyleneblue.red and you can learn a lot more about it. It's a website that talks, has a bunch of articles, and as you looked it up, and that's great. But so you got a chance to get that, and you got the light, and
Yes. And then because of that, because we were convinced, and we also had our medical doctor assisting us so that we felt confident. Then we ordered the helmet,
okay.
and then we ordered the helmet. It came the middle or last week of January, and then we've been using the helmet once a day. After Tom has his methylene blue, and then
And
we
about how long do you wait about 3 hours then, or 4 hours after the taking the methylene blue, or how long
no
do you
within
wait?
a half hour. Within
Within
a
a
half
half an hour.
hour.
Okay.
Uh-huh.
It
And then go ahead. Yeah.
There's the helmet right there that we're talking about, and the bright red wavelength, which is this one right now, is the right wavelength to photoactive actually work with the methylene blue. So you have that. Oh, yeah, obviously you have it. I can see it in your picture up in the
Right, right,
there. Very,
right.
very good,
And
very good.
we use it for 2 minutes, and then we go to the near infrared for 4 minutes usually.
Okay, all
Is
right.
is how
And
we
so
did it.
how has Tom been doing? Tom?
Well, I was doing fine and making great progress, but I had a setback on Thursday, May 8th. I slipped getting out of the bathtub and came down on the side of the tub and cracked 3 ribs.
Ooh.
So I wanted to mention that I've continued to be using the red light and the methylene blue and everything, but is there anything in particular in view of that setback that you would recommend as to?
Other than treating the ribs as well now, not that you started there, but now you need to, but that was in March. So you've done
No, it
some.
was in May.
Oh,
It was in May. May
Oh,
8th.
it was in May. Oh, well, it's very
Just a
recent.
few weeks ago.
Yeah.
Okay.
They told me at the hospital it would take 3 to 6 weeks to heal, but I'm going on my third week and I'm feeling much better. I have been using the red light therapy regularly with the methylene blue, and I believe it's going to be fixed up before the 6 week period.
We had a cyclist. That and there's a webinar that I did with him. Name is not coming to my mind right at the moment, but he was riding his bike, and he's an avid cyclist, and he was going through some back trail, and there was somebody had made a mistake when they did something on the trail, and as he was going forward, his front tire caught right into this rib and threw him over the handlebars while he was going at a fairly good pace, and he busted up a number of ribs, and he was in great pain. They took him out of the area with an ambulance, with a stretcher, and got him to the hospital, got an X-rays and all that. He was, and they said, you know, he was able. They says there's not much we can do. Just bear it out. And so since he had the mini canopy, that's this one
Oh,
here.
yeah. Uh-huh.
He was able to use that on his ribs
Wow.
right away, like day one. And as a matter of fact, not only did he treat his ribs day one, like the first day that this happened, he was discharged from the hospital. They did the X-rays. They said, "Yep, you got broken ribs." And he said the pain had so much gone away that he was able to go back on his bicycle the next day. Now, I wouldn't even attempt to do anything like that, but he said I was able to do it and do it without too much trouble. And after a month, he thought, I really want to see,
Wow.
how this has worked out. So he went back to the hospital, requested another X-ray, and the X-ray tech came back and reviewed the X-ray with him and said, if I didn't know better, I can't see that you broke your ribs. It had healed
Wow.
that much in 1 month.
That's wonderful.
So yeah, definitely be treating we've had other people with other broken bones that have healed extremely quickly with the light. So yeah, so you've been using the light, and have you allowed other people to use the light as well?
Well, now we have 6 palm lights. Okay. I mean,
I
we
didn't
are
know that. I didn't know that. I didn't know you're up to 6. I knew
we're
you.
up to,
Okay.
okay, we're up to 6 palm lights. And we have 2 out on loan right now. One to a MD, a radiologist who's a friend of ours and does laser therapy, and he's using it for his arthritis. And then we have one on loan to an 89-year-old friend that belongs to our faith, and she broke her wrist and fell down the stairs and had to have surgery. And there was a very large bump, and she, they've been going through physical therapy, and so she's been using it, and the pain is gone. Now that the wrist, she broke the wrist in November, and so we loaned it to her after her surgery, and she's been doing very well with it also. So we have 2 out on loan, and then all I can say is that I'm a sucker for pain. And when people say they're in pain, I just say, come on over. We had one of Tom's best buddies, was it today he called you? And he said, Tom, can I come over? And so we have a room set up here that is private access. But we have the palm lights set up on different stands. You'll see like this
Yep.
next to the chairs. And you'll see we have one over there. And
Yeah,
then,
so that stand is just to explain to people. Turn it back to the
yes.
So that we have on our website, it's called the palm adapter. It's a device that you snap the palm into, and then from there, yeah, just like that. There you go, and it locks itself into a standard a tablet holder, and that's what is really nice, because you can put it on an area of your body and let it do the light treatment there without having to hold it in that place.
Yeah, that's the advantage too. As soon as we get our income tax refund back, we're going for the panel, the small one. Oh, yeah, we have another friend that I used to work for, and she works in a hospital setting. She works as a social worker on a what we call a psych ward.
Right.
She's been in this field for close to almost 35 years. And she went to emergency 10 days ago. In our area, there's a lot of problems with thyroid because there's low iodine in the Great Lakes area. And she was told that and you could see it, she had a mass like this, and she couldn't breathe on her throat. And so she went to emergency, and they said, she had to they did a CT. They told her to go the very next day, have an MRI done. She'd have to have her thyroid removed. Well, this woman is hardcore. She's been through a lot. She's been in hospitals. I mean, working in hospitals,
Right.
and she's also holistic. So anyway, we put her in touch with the clinic in West Bloomfield, Dr. Brownstein's clinic. She called, she got in 3 days later, but in the meantime, she was able to have 4 light applications. And it's not that it cured the disease. No, it reduced the inflammation that was around the problem. And it went from like a grapefruit, and it's now just the size of a baseball. I mean, dramatic.
Yeah,
And
if she keeps doing it, there's a very good shot that she can reduce it right down. People with nodules on the thyroid have had their nodules disappear, so it's
that's
possible.
wonderful.
Yeah,
That's wonderful.
and what people don't know is that with thyroid applications, definitely be in touch with your MD, your
Yes, she is.
but it can help with overactive thyroids. You can help reduce there's actually down regulators that the light helps the body to utilize those down regulators to fix things in one direction. Or if you're hypothyroid, we've also seen where the thyroid function improves. And so that's why you
Nice.
if somebody is on like a Synthroid or some of these other types of medication for thyroid, you can actually help that, but then you're going to need to track the improvements as well, like so that if you are you don't want to stay on a specific drug if your body doesn't need it. So you need to be tracking that with your physician or your to make sure that your body is always staying within the right range.
Yes.
So
Yes.
so it may take thyroid stuff can take months before you get change. So definitely look at continuing the usage.
Yes.
And
Yes.
it's
She will be buying a palm light when she left the house yesterday. I said,
it's that easy. You just tell them, here, go ahead, use it.
and so she'll be coming again tomorrow, and then she'll have her teleconference with her MD in Michigan. But everything, all the blood work's done, and they know what they have to work on now. And she's not just scatterbrained about this. She knows you have to address it medically, but the palm light took that swelling down, and she can breathe now,
That's
which is
beautiful.
very important. Yeah.
Very, very good. Very good.
Yeah.
And well, it's really neat that you can help your neighbors. I'm wondering, I didn't have a chance to ask you, but what do you think if we played that short video that you
Oh, yeah. And it's less than 10 minutes. If you just want to go through it, we have some short videos of Tom in there and
Yeah.
us using the palm light.
Okay, why don't we play the video right now for just a little break, and then we'll come back on with any questions and answers. So as you're thinking about this and our discussion, please think about your questions, and in the chat, write down your questions, and we'll try and answer any ones that we can. So go for it, and we'll do so right now we'll switch over to the video, and here we go. Yeah, I just wanted to say that there's for some that might be queasy, there's a picture here that might look a little rough, and so if you're in the midst of supper, you might want to just look the other way for a moment. We don't want anybody to lose their supper, but let's continue on. Here you go.
this is my finger. I had a splinter surgically removed. It's not infected. Henry County Hospital did a good job. There's no antibiotic. I'm on no pain medications, and actually it's not painful at all. And we've been using red light therapy for the wound. Here's the red light, and I just let it set for a minute on each side to encourage cellular healing, and it works really well. They use it for diabetics, but I'm on no pain meds or anything. I really am enjoying learning things. This is day 8 with the finger since the surgery, and it's really looking really good with the red light therapy. It's healing very well. Just leave it for a minute on each side with the red light, and the near infrared also. But if you look very closely, you can see how well it's looking. So anyway, that's day 8 after the surgery, and it's healing up quite nicely, just quite nicely.
You can see also there's range of motion on that finger as well.
This is my finger that I had surgery on. I had the splinter removed. That was on the 17th of December. And today is January 2nd, and we've been using red light therapy on it, and I'm telling you, it's remarkable. The inflammation is minimal where the stitches went through yet, and all I can say is I've never had an antibiotic. The doctor didn't recommend it. And no pain meds. I was told I could take some if I wanted to, but I had no pain. And then the red light therapy was applied a minimum of twice a day, but sometimes 3 or more, staggered out with the red light for about a minute, and then the near infrared for 3 minutes. And it's looking really good. I mean, it's really good. I haven't had my 3-week follow-up yet, but the stitches were taken out on Monday, the 30th. So that's where it's at right now, and we're pleased. Great. Oh, honey, that's just great. Beautiful. Okay.
You out here, are you?
Nope, I'll get out by the front. Do you need to get out here? Okay.
Hi.
Mouthful.
She said short.
Short video. So we do the 1 minute 3 with the palm light orally. We're doing it this morning. We have a really long day. I think the Palm Light orally, what it's doing, I'm not an anatomist, and to use the pipette, or not a pipette, the pipe with 2 different lights, I think I would be hyper-focused and perhaps move it to not actually broadly cover the locus ceruleus, that I would perhaps miss the benefit. And with Kerber's palm light, what I think he could do is actually make a mini palm light that would set, set just right between the teeth orally, a little mini palm that would broadly illuminate that area so that you had vascular, infusion to the locus ceruleus, and also then drainage away. So I think we should talk to Tom Kerber about making a mini palm for oral use. I think it's a great idea, and he's the man, right? He's the man. How do you think the helmet has helped you?
I don't know. I've been told it repairs brain damage from the stroke. You say my sense of humor came back after I started this. But I can't really specify anything in particular. I don't think I'm getting worse.
What do you say?
I don't think I'm getting worse. She can't hear.
Okay, we're going to switch to near infrared now. What we do is we time it, and usually it's 1 minute and 3. And sometimes we do it twice a day.
Anyone who does this ought to have his head examined.
There's the humor coming through. Okay.
My hair is becoming more attractive.
Okay, look here. Right hand. Right hand shaving. Oh, he just cut his throat. May 1st, we're doing the cranial helmet, usually in the mornings. Tom, you got anything to say to the camera?
No.
Okay.
So we can't talk about some of these things, but we can say that suspicious, weird types of skin problems have been helped with our product.
This is just a brief overview of our sauna and our therapy area, a room with grounding mats. And then this is our red light area with 5 different hand devices, a cranial helmet, and then grounding mats for the friends, a face mask, a little coffee bar, coffee and water bar with a refrigerator, and this is all at no cost. Most people bring their own water. A handicap shower and a toilet.
Well, Thank you very much, Tammy, for pulling this video together. It's really, really neat to see how your husband has improved and how you took an active role in trying to help your husband get better. And as a matter of fact, this is the first time, I think, in our show history that we've had two Toms on at the same time. Usually it's just me. So anyways, it's great to have you on. And if you want to turn your video back on, we're
Okay.
just going to see if we can answer
Trying.
questions. So thank you very much, Tammy, for pulling that together. That's great.
After this last minute, breaking my ribs, I think I would have been very, very discouraged at the progress I have lost if were it not for the red light. I still feel very optimistic now because of that and confident that much of this can be regained, and I want to thank you.
You're welcome. You're welcome. Well, we do need people to prove out our products, so thank you for using our product and showing how it can be used. I wouldn't suggest that you go as far as to break your ribs to prove how good the light is, but
Good point.
So we'll answer some of these questions. I'll work away at it. So let's go. Let's see, because there may be, and I'll pose the question to you when there's a question that which do you happen to have the methylene blue that somebody's asking about what it is? If you could bring it up to your camera.
Yeah, I'll get it. And somebody wants to get I'll go get that. Yeah.
Okay, all right. And I can so Eric is asking question. My name is Eric, and I would like to know which palm you would recommend as initial light. I have pain in both knees and elbows from arthritis. Eric, I really recommend that you mentioned initial light. This would be a light that you'd use all the way through. There you go. Okay, so you can see the USP grade ultimate methylene blue, and it's I forget, a 2-ounce bottle. Is that? I can't quite see how many ounces is in there.
Yeah, it's a 2-ounce bottle. Yes.
Yeah. Okay. All right. So thank you very much for showing that. So Eric, I would recommend the Palm Ultimate or the Super Palm. Both would probably be very beneficial to your situation for reducing pain and swelling, and when it comes to arthritis. I have seen so many people helped who have had arthritis pain and reduce their pain. Have you come across that, Tammy, as well for somebody with arthritis, or not yet?
No, we have someone who very much has ankle pain, and they're using the Ultimate Palm.
Right.
Now we have all three palms. We have the professional. Yeah, we have the professional, the Ultimate, and we have the Super Palm. For the thyroid issue, we use the Super Palm.
Okay.
I had my friend use the Super Palm, but either the professional or the Ultimate, one just takes a little bit longer. I tell people if they want to buy a palm, to buy the one that's lesser in price, $975, because if they're at home, they can do it as long as they want, just as long as they want.
Unless you will shortchange your treatment because you just want to get going, then definitely move to something that'll treat a little faster, which is the Ultimate or the Super Palm for that kind of thing. Okay. Thank you. Marilyn was asking, and so which of the palms do you use? You use all three of them. You've used
all three of them. Yes.
Yeah. Okay. So Eileen is asking, okay, for the bad cell lumps, what results did you get back?
From the ones that on the shoulder?
The ones that those, and it came back negative, right?
Yes, it was a suspicious lesion, and because Tom is on a blood thinner from his stroke, he would have had to go off his blood thinner for 1 week if and he would have had to go into the operating room and have this, taken a deep
Yeah.
surgery to take it out. So we talked with his physician. He was cool, totally, yes, let's try red light, try methylene blue. And then you saw through the progressions of videos that the suspicious lesion, it receded, it went back to nearly a clear resolution of color, and then he only had to do a shallow scoop. Rather than, Tom never had to go off his blood thinner, didn't have to go into surgery. It was done in the office, put a Band-Aid over it. That was it. And it was negative.
Yeah, that is fantastic news. That is
Yes.
fantastic news.
Yeah.
And just for, it's beautiful because the body knows how to deal with things when it's got the right equipment, right things. And you're giving it also by using the light therapy, you're also improving the immune system. So it can handle it very, very well. Okay. Eileen is asking how long before you notice an improvement for something like rotator cuffs. I've got it varies so much from all different people. Like some people, I've got people that have had, a lot of pain and they've done one treatment and they're like, what the heck just happened? I can move my arm. I couldn't do that, half an hour ago. And we've had that kind of thing. Other people, maybe something that's going to have to take a few weeks or a month, depending on what's going on. If there's a tear, it's going to take a lot longer. We had Dr. Ryan Cole on, who talked about how long it was going to be a process, or they figured about, I think if I remember correctly, 4 months before the healing. And he had his improvement in 4 weeks. So, so yes, it can, everybody's quite different, but definitely this helps everyone when it comes to helping the body to heal. Okay, so Mary is asking, what is the maximum time per setting? It really varies. If you're treating something like skin stuff or the brain, I'll say, first I'll talk about the skin stuff. When it's very superficial, you're going to be using short treatments, just like you did with the finger. 1 minute red, 1 minute near infrared, or 2 minutes near infrared. You don't have to do that for 20 minutes. But now if you're talking something deep in the body, like sciatic hip pain, where it's in the joint, the nerves are pinched, and there's muscles that are around there, you may have to spend like at least 5 minutes of the red and 10 minutes of the near infrared. And we had one fellow that came in here. So if it is, and also the brain, I'll just mention with the brain, usually we talk about 1 minute of the red and 3 minutes of the near infrared on the area that needs to be, let's say, if you don't have the helmet, the helmet is 10 of those. So it works out really, really nice to do a very quick treatment because it's doing the entire skull at one time. Whereas the palm light, you'd have to just spend more time because now you got 10 locations, and we got people that are using the palm light on their brain for different type of treatments. As a matter, yeah.
And one of your physicians that you interviewed, you had 2 physicians on 2 weeks ago, and he brought to our attention, which people should remember, that whatever side of the brain the stroke is on, an ischemic stroke, that it's the other side that is affected. So his advice was, if your right side's affected, then put your palm light on the left side of your brain for the healing that way, or vice versa. So that was.
Yeah, that's very much so. And then what we have found though with the helmet, you're covering the whole area, so it is okay. But there is, you can also do with the palm light, you can treat selective areas, or you can, even if somebody has a helmet and they really want to just treat one half of the brain, they can always cover up the other side. That's easy enough to do.
Right.
So okay, let's got some more questions here. Okay. Mary says, thanks for your support. how many minutes can the palm red and near infrared be used continuously? Okay, first of all, as far as the device itself, this device you could turn on and leave on all day, all night. It's not going to be harmful to the unit itself. Okay, so there's no issues with longevity as well. Like the LEDs in here are built for like 50,000 hours. So the LEDs, and even at 50,000 hours, is because I'm keeping them so cool, you're only going to be looking at about 10% loss of light. So nobody has to worry about that side of things. But when it comes to, I'm not going to suggest people go take this in your bed and fall asleep with it on your brain or on your neck. That's not what I'm suggesting at all. But hey, you can have it a certain distance away, and yeah, you may fall asleep, but not if you're having it right against the skin. You're not then cognitive of an area if it starts getting too warm. If it gets too warm, you just pull it back a little bit. But other than that,
We have found that I have fallen asleep with the light and woke up 4 hours later, but we have found that if we have individuals in our wellness room, not, sometimes we have 2 or 3
yeah.
persons, and people don't like to fall asleep in front of other people, but if we have someone
Yeah.
in the room
Oh,
by themselves.
it's so calming. I mean, yeah, it's just people can fall asleep. I'm just gonna say for ultimate safety,
Yeah, it relaxes you.
don't fall asleep with it. But generally,
Yeah.
I've had people with treating for long periods of time. As a matter of fact, one individual, they came into our office and they had been dealing with an extremely swollen ankle, and it had been going on for, I think it was over a month. And I mean, it was large, you could see it. And some would say, oh, no, no, you can't treat too long. Well, if it's a musculoskeletal issue, you don't have and it's not just a skin issue. So you're not just trying to treat some burned skin or whatever from a burn or something that has happened
Yeah.
where it's very superficial. You can use it longer. And in this case, we had the panel here that is the large panel, and he was talking to us, and we did about 15 minutes on each side of his leg by his ankle, and he was already feeling better, but he says still kind of painful. Well, we said, just not a problem, just keep treating while we're talking. And about an hour and a half later, he was walking across the room saying, "This is crazy. Like this it even that extra time was very helpful." So in musculoskeletal issues, it's really not too bad as far as treating. And we had with our helmet, we've had people with migraines, and we'll do
Oh.
the 1 minute, 3 minute treatment. And at a show, we had 2 individuals that came through, and both of them had significant migraine headaches. And they did the first 1 minute, 3 minutes, and my son-in-law decided that they said, well, yeah, there's still a little bit of the migraine left, the headache left. And so he says, well, let's just do another round of 1 minute and 3 minutes. And they did. And for both cases, the second round of light totally took the migraine away. Like so in that case, it would have been equivalent to 2 minutes of the red and 6 minutes of the near infrared. So anyways, so as far as length of time, it's not a problem for length of time. Eileen is asking, thank you, Mary, for your question. Also, Eileen's asking how long before you notice an improvement for something like a rotator cuff. Really, it does again vary. I've had everything from almost immediate, same day, to seeing a definite improvement over a course of a month. And one thing that it was really funny one time, I had somebody who said they came in and they could barely lift their arm, just a little bit to the side. And I don't know if they had 10, 20 degrees of motion. And
Mm.
what happened was I asked them to, before I started, I always ask, how far can you move your arm so I could see it. And then they did the light treatment, and I says, okay, how is it now? And oh, it's still quite painful, really painful. I says, yeah, yeah, but do you see how far you're moving your? Oh, yeah, yeah. Well, it now starts being really painful up here. They don't. It's hard sometimes for people to see for themselves.
Yeah,
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 you want to readjust my brightness because I'm losing part of my head here.
yeah.
Don't
There's
know.
something else. There was a question about Tom's glove on his hand here. And this was again, it's copper compression, and it's because his right hand would sometimes get colder than because of blood flow. And so we talked over with the therapist and they said, go ahead and use that. So, but Tom's blood flow has increased so much better with the light. But this glove, it's copper compression. Our therapist recommended it. So Tom wears that from time to time. So that was a question in one of the chats. So
Blur the
yeah,
back.
yeah.
Oh no, don't do that. I've just yeah, I
It's
guess I got a little blurry. I was drinking too much.
whatever,
uh,
whatever.
we're having a little trouble with our computer for some reason. Something's going a little weird here, but I was disappearing there for a minute. But anyways, yeah. So let's see if I can answer another question or two here. There we go. Okay. I got my head back. So anyways, question came in from Beth. Yeah, neuropathy can be caused by all kinds of things. It can be caused by diabetics. It can be caused by chemotherapy treatment, can be caused by all different kinds of things. But we have seen all kinds of different kinds of neuropathy helped. So, and it's also very, very important to learn where is if you can track back when the problem first started. I had one woman who had, well, actually, my mom, when she was still living, she had a very good friend who was 92 years old, and I saw her at her house trailer, park model kind of thing. And she had been, for a few years, dealing with neuropathy, and she had it in her feet. And I had asked her a few questions. She says, so where do I use this light? And after I assured her that my mom was an avid user of the light, she felt fairly confident then to give it a try. So she used I found out from her that she had back surgery. And I says, oh, okay, well, on the spine. I says, well, why don't you use the light there first? And within about 4 or 5 days, that neuropathy had totally disappeared
That's
from
wonderful. Yeah.
on her spine. So it's a case of trying to figure out where is the neuropathy coming from. Is it a pinched nerve in the knee? Is it a pinched nerve in the hip joint, or is it a pinched nerve back in the spine, or is it some other muscle that's causing trouble? So yeah, it's a case of trying to track it down and trying the light in different locations. So okay.
Right. There was
Yeah.
another question, Tom. Someone said, how can you use the light for your immune system? It was early on. And I just want to point that you had a physician on whose wife had cancer. And he demonstrated, they might go back to one of your videos, and he demonstrated how to use the palm light on your lymphatic system you start at the top. Do you remember from the
Yes,
groin?
yes, that was if somebody wants to look that up, it was Mel Birchman,
Okay, good.
a medical. He was a dentist who used the light to keep his wife's lymphatic system running
Yes,
properly,
yes,
and so it's
yes,
a case like a river. You don't
yes,
when you're trying to deal with a river, you want to clean out the base of the river first, and then work your way back up to the source, the where it's draining from, rather than working the other way around. So that's something we do have a lymphatic diagram. We do see that we got a lot more questions, and I do know that we'll go on for about another 5 more minutes. I do have another commitment tonight. So what I can say is we will get a copy of the questions that we have here, and we'll try and answer them. Anybody who wants to send us a direct question email can send an email to info@SunPowerLED. We'll have that in the chat bar there, info@sunpowerled.com, and we'll try and answer it from there. Um, okay, so Mary is asking, if we don't have a helmet, how can you use the palm to achieve similar results? And again, it's basically, if you're unsure of where you need to treat, you might want to look at treating like 10 areas across so that could be, forehead, temple, back further down at the base, and work your way around. And on the top here, so you got 10 locations. That's kind of what we found that people have seen improvement. The other thing would be, if you have if you know of the problem where you have some issue, you could concentrate in that area to save yourself some time. Okay. Mary is asking another question about osteoporosis. What would be the exposure time and body part? Well, again, you could be treating the areas where you have. I know that's loss of bone, but where is the biggest concern that you have? Turns out that the big bones, your thigh bones, are the ones that produce help with production for your immune system, the white blood cells and that. So it's always good to treat the big bone area for various problems. Okay. Okay. So Joe is asking, would it be possible to treat lumbar stenosis and sciatic? Definitely. One thing it can do as well is sometimes when you have it, let's say an injury in your spine or stenosis, you get a pinching of the nerve from the muscles pulling to try and hold that area so tightly. And sometimes the muscles just are pulling too tight. They're overprotecting kind of the area, and then that worsens the situation. So if you're able to put light on that area, it'll help loosen the muscles, and that'll can help with the healing to start turning that around. So I thank you very much, Penny, for your question there. Okay, so is eye protection recommended? Only time I'd say that you'd be more concerned about light protection, it's not just in the normal usage of it, but if you find that somebody's super sensitive to it, you can always wear darker sunglasses. If you're trying to treat longer around this area, you might want to use the sunglasses if you want. But I do have people that are using it directly over their eye like this with the eyelids closed. Everybody with the eyelids closed, you're using 1 minute of the red and 1 minute of the near infrared. That's all we're talking about as far as light output. Now, just to give everybody a comparison to this, and I've said this in a few webinars, is that you don't see signs posted on the Florida beaches or California saying don't go outside or don't go on the beach and sunbathe or you'll go blind. Turns out the sun gives off 100 milliwatts per square centimeter. So every square centimeter is 100 milliwatts. this thing's close to that. It's anywhere from 100 to 180 milliwatts per square centimeter is coming out of this device. So we're not we're not suggesting you treat yourself with 100 milliwatts per square centimeter for an hour at a time. We're saying 1 minute treatment. So, and your eyelids are closed. So it's very much like you're on the beach. And, we may be doing 1 minute of dosage of each. So 2 minutes. If you're out in the sun, and you're there for 2 hours, you're looking at 60 times the dosage of using the palm. So, and it's all in the red and near infrared wavelengths, which are extremely safe compared to some of the wavelengths that do come from the sun. The sun is a beautiful, well-designed creation in the sky that is very beautiful for all of us. I think what we messed up on is some of the food that we're eating and some of the other things that used to help with our bodies for protection. And how many times are we inside and the building and not getting proper light? And then we go out and we go and expose ourselves. Whereas if you do yourself every day, and moderate amounts of sun, it's something that's pretty safe.
I have a question, Tom. We have a friend who has a knee replacement. Have you had any experience,
Yes. Yeah, so the great thing is, sure, a knee replacement might get rid of the pain, depending on, some other things that may happen. But as it turns out, if you can use the red either before the surgery takes place, that's great to start before the surgery, because you're actually helping the immune system. You're helping the cells to be ready for the trauma. So it's giving them all the energy they need, everything they need to try and deal with this new upcoming event of this trauma surgery that's going to take place. But also afterwards, it's going to really help the blood flow, as you showed in your finger, 2 weeks and a bit, and you've got beautiful healing that took place.
Yeah, and notice you can't even tell it where it was now.
There's the demonstration is you don't see scar tissue forming because there's no scar tissue forming because the light helps. What a beautiful example. Now you did show us the finger that you injured. You weren't trying to show.
No, this is not a sleight of hand trick.
Yeah, because I know somebody would be out there saying, "Oh, you showed the wrong finger." No.
I have to be careful because of, it's not the wrong finger.
Yeah, exactly. Now, is it would it be possible to? Okay, I think I answered that question. Yeah, I answered that one. Okay, there's a question here from Susan. I see Tom has a glove on his right hand for edema.
No. Show the glove, Tom. No, it's just a copper compression glove. It would help with warmth.
Oh, all right.
Or for insulation.
Okay, yeah, all right. Give some extra, keep it a little warmer, and when you do, you get more movement as well. It helps everything. Yeah, I understand. Okay, thank you, Susan, see, there's people in this group that really do care. She was going to say, so she said, and my friend does lymph therapy, and I have benefited greatly from her treatment. So that's all about the lymphatic system. You can help there's people that specialize in helping to improve lymphatic drainage, and that's something definitely to look at. Okay. Can you put your face in the helmet to work on dental and eye issues at the same time? Absolutely. I got people turning themselves around. And if you want to do longer treatments, you could always put like little tiny speedo glasses on if you really want to help reduce the amount of light power, but turn yourself around backwards in the helmet. And just like Tom does once in a while, Tom is actually 120 years old, but look at his skin. No, I'm just, I hope everybody realizes that was a joke. No, but I have people that have turned themselves around looking into the back of the helmet to do
Yeah,
skin treatment
amazing.
on the sinuses and on the
Yeah,
eyes and
yeah.
stuff like that. So not a
I
problem.
want to bring out that one of our friends is a doctor here on the where we live out here in rural Ohio. We're in the state of Ohio, Northwest Ohio. Um, but he came to see our room and he bought a helmet. I mean, he got the helmet delivered 2 weeks ago.
Oh,
Um,
fantastic. Thank you
so
again for telling people. They won't know about this and unless people tell them. So
yeah,
and not
and
only
then he'll tell others. He'll tell others, you know.
and I will say, please, everyone who's watching tonight, please go to the YouTube channel at SunPower LED. I have a YouTube channel and subscribe, okay? And like, there's this thing called like. You push the like button, and more people will get a chance to learn that this is something good, So please do
Yeah.
that. And also, if you do subscribe to our channel, YouTube channel, you'll be able to be as soon as a new video comes out, you'll know that it's happened and you can watch it in your time.
I see a question. I just want to address this. Someone asked what was the dosage on the methylene blue. We did not do the dosage on our own. We consulted a cooperating physician who did the enzyme blood test for Tom, and then he recommended a dosage.
Right.
And then after a while, then he said that dosage, with the consultation of a pharmacist, a compounding pharmacist in our area, then we upped the dosage. I am reluctant to say what dosage we're taking because persons might use us. Well, it helped them, but
Yeah.
this
You
really
need
should
to
be done.
Thank you. Thank you, Tammy, for saying that. Okay,
Okay.
I have to go into another call. So another commitment. Tammy
Yes.
and Tom, I want to thank you so much for being on the program tonight. It's been wonderful. I'm sure a lot of people will yeah. And I see one other concern somebody asked about. It appered to be bloody. That was
Oh,
the
that was
one
that was
suspicious.
that
That's
was
because they did the diagnosis of the area. They
Yeah,
did
the biopsy.
the
They did the
biopsy.
biopsy. I was just showing that it was totally removed, and then the biopsy came back negative for any type of suspect
Right,
uh,
right. I just saw
suspect
that, and
lesion.
sorry, there's one more here. Can it be used in pets? And yeah,
Yes.
for sure, we've got lots of pets using that. Further questions? Any other questions? I'll try and answer them if you, or our team will try and answer them. Thank you so much for being on
Thank you.
tonight. I want to wish
glad.
everybody God's richest blessings. All the best.
Thank you, Tom.
Bye for
Good
now.
night. Good night.